I think one of the most important features of a woman is the skin. There's an old Chinese saying, a white complexion is powerful enough to hide several flaws, and that's definitely true. If you ask me, there's no age too young to begin a good skincare regimen, but as we age, our skin changes, and it is important for us to alter that according to our needs.
It goes without saying, and it's been drilled into us from young. Eat healthy, eat a lot of fruits, eat a lot of vegetables. Now, why? Well, there's a reason, good reason behind it. All these contain plenty of antioxidants, vitamins, gives you a natural glow, provides fiber, which is essential for getting rid of all that toxins in your body. What's important is, so what if you eat healthy, but if you're not eating the right things as well? No point having a healthy, full of fruits and vegetables diet if we are also consuming junk food, trans fats, sugars, processed carbohydrates. Now, all these are bad. What they do, they produce what we call AGEs, advanced glycation end products. Big names, big terms, what is it? All we know is these have an association with a number of diseases like heart disease, diabetes. What's worse? Eat all this, damages the collagen, the fibers on your skin. So why eat healthy and not eat right? It's not going to help you in any way. So eating right, not just eating healthy. It's the key here.
Last but not least is confidence. I'm a true believer that if you're confident, you're going to be beautiful.
This is a long question you're asking me. Before I go on to share my daily regime, I think the most important thing that one should know is, as skin ages, it becomes less elastic due to decreased production of collagen and elastin, resulting in wrinkles and sagging. Also, older skin produces less natural oil, so it doesn't plump up those nice fine lines that we use, the way that it used to. So while you're probably not seeing those deep wrinkles and the serious sagging in your 40s, but the first few things that you'll notice are the crow's feet, the blotchiness from sun damage, and also the less firm skin that you once experienced 10 years ago. So what do you do about these things? Now, the few ways. Your skin regime should not just extend to prevention, but as well as to repair and maintenance, because we've said all these things changes when you reach 40. My daily skin regime would be cleanse your face once in the morning, once in the evening. For daytime, I always use my SPF. Never go anywhere without my sunscreen. Very important. For evenings, I will use my peptide serum and the collagen repair cream. All for the same reasons that I explained. As skin ages, we lose elastic, we lose collagen, and we lose the moisture. So all this is to replenish it. As I've mentioned, when you reach your 40s, the first few signs you see are your crow's feet. A lot of people don't like that. Botox, simple, quick, non-invasive. The other thing that ladies, especially ladies, even men, they notice is blotchiness in their face. They find that they're getting little spots that didn't used to be there. So again, there are various non-invasive skin resurfacing techniques that is in the market, such as chemical peels, dermabrasions, and laser resurfacing. They all achieve the same results basically. What they do is they injure part of your skin, and the whole idea behind it is that the healing process will progress and you get a new, healthier looking skin that emerges.
Firstly, I think everybody should start to know that acne is a treatable disease. To seek treatment early, because if we leave acne for too long, they tend to scar up, and that can be very difficult to treat later on. Most important, I always tell my patient, is there's no magic in the treatment of acne. It's patience, patience, and patience. Most treatment, regardless of what we do, is going to take about 6 to 8 weeks or more time to see any difference. It's also important to stick to the treatment plans and to return for regular reviews. The problem with acne treatment patients is that they tend to doctor hop and accumulate tons of products in their home that they never use. So please don't do that, because you will just be circling around the same steps all the time. So it's important to stick to the same doctor and stick to the treatment plan and be patient.
The difference between, firstly, you have to understand the difference between the over-the-counter product and cosmeceutical products. Over-the-counter products, they do work, not to say that they don't. It's just that they are in lesser strength, and the ingredients and the properties are natural finding ingredients. Whereas the cosmeceutical products, they are of higher strength, and the ingredients that are found in them, they are very common ones that you see in all your cosmeceutical products. They are antioxidants, AHA, beta hydroxy. So these are all chemical terms basically, and they've been shown and proven to work. Example, retinoids. Retinoids are what we give to patients with acne. Retinoids is now being introduced into cosmeceutical products. Okay, because one of the side effects of retinoids is it gives you a nice glow and removes pigment. So it's shown to prove that it works, the benefits of it. And because of that, it becomes part of your cosmetic regime. Because you can't sell retinoid to somebody who doesn't have acne and say, use the retinoid, it's good for you. So you can't do that. So what the cosmetic dermatologists do is take that active ingredient and put it in your normal moisturizer with the active ingredient, and that would enhance. So whenever they tell you this is good for fine wrinkles, good for pigment, good for this, that's because they have an additional ingredient, additional pharmaceutical ingredient that enhances that product. That's the difference between the two.
I think in today's world, whereby everybody is getting more educated and knowledgeable, it's important to be their friend, educate them and give them all the options and work with them to choose one that is most suitable for them.